Congratulations! Your skin cancer has been cured and you are on your way to a great recovery. We will review with you how to take care of your wound, and we will also give you an important FAQ sheet to take with you. Please keep this sheet and read it over, as it will address most, if not all, of the questions you may have at home. There are a few points we want to emphasize today. Our number one concern for you when you get home is bleeding in the first 24 hours. For that reason, we do not want you to engage in any strenuous activity or exercise for at least 24 hours. Avoid bending over or straining, and no alcohol tonight either. It makes you bleed. Take it easy for the rest of the day at the very least. Get your feet up and rest. Even if you don't feel exhausted, your body is exhausted and needs rest. Your post-operative discomfort will peak about 6 hours from now. For that reason, we want you to take a rotation of Tylenol and Advil every 2 to 4 hours. Even if these pain medications have not helped you in the past, they are well studied as being equal, if not superior, to most prescription pain medications for this type of surgical pain. As with any surgical procedure, there is a risk, albeit low, of a skin infection. When infections do occur, they typically present in the first 48 hours. Infections are associated with burning, intolerable pain, lots of thick, runny discharge, and bad odor. Many patients will get concerned and misdiagnose themselves with infection. All healthy wounds have a pink rim around them as they heal. All open wounds will make a yellow, stringy material called fibrin. This is a normal healing protein and is not pus. A pink wound with a yellow, stringy discharge, although not lovely, is not infected. Last, I would like to talk to you about the cosmetics of your healing. It is important, first and foremost, to remember that you had a cancer and it required surgical intervention. We strive to preserve your natural beauty and appearance, and every nuance will be utilized to give you an excellent aesthetic outcome. But it is not realistic to expect a complete perfection after cancer surgery. For most of you, our goal is to get you to a point where no one but you and your surgeon can see your scar. For others with more catastrophic cancers, our goal will be preservation of function first and foremost, with aesthetics taking a back seat. Regardless, be patient. You will continue to improve and your scar will continue to settle and fade away for the next 12 to 18 months. Don't worry if you don't look great 2 weeks from now. The scar will fade with each passing day. Today, you had a full-thickness skin graft taken from one part of your body and applied to your wound. Skin grafts take longer to heal than regular stitched wounds because the grafted skin needs to regrow and reattach to blood vessels and nerves. Therefore, you can expect significant swelling, discoloration, and flaking for 2 to 4 weeks. Please be patient with your skin graft. It will continue to improve with each passing week. Some patients have skin grafts taken from a site adjacent to their cancer surgery. In that case, you may have only one bandage. This bandage needs to be kept in place for the next 1 week. All of your stitches will dissolve, but it is important that these stitches are kept covered and dry. Yes, I did say dry. It may seem difficult or even impossible, but there is a way to keep this wound dry and keep your bandage in place over the stitches. One of our staff members will share with you some helpful tips for keeping the wound dry. Many of these tips have been learned from the over 10,000 patients, such as yourself, who have undergone this procedure in our office, almost all of whom figured out how to keep their wound dry. Some patients will have skin grafts taken from one part of their body and placed onto a different part of their body. For example, a skin graft may have been taken from around your ear and put into place on your nose. Wound care instructions for these donor sites around the ear vary from patient to patient, and one of our staff members will make sure that your specific instructions are clear and understood for both your graft donor site and your graft recipient site. In the unlikely event that you have bleeding this evening, please apply direct and firm pressure to the bandage overlying your wound. Direct and consistent pressure must be held for 30 minutes. No peeking or checking. After direct, strong pressure for 30 minutes, almost all wounds stop bleeding. Occasionally, you may need to wrap the surgical area with an ACE bandage in order to apply direct pressure. ACE wraps or other elastic type wraps are very helpful. In the exceptionally rare situation where bleeding cannot be stopped using these pressure methods, it may be necessary to go to a local emergency room. But only seek emergency care after attempting at least 30 to 60 minutes of direct pressure. A slight drip or discharge from the wound is not cause for concern and can be cleaned and ignored. I hope that your experience today exceeded your expectations. I know it has been a long day, but take solace in the fact that your cancer is cured and you are now on your way to healing and getting back to all of your normal activities. Many of you have chosen to travel from all over the Southeast to have your surgery performed here today. Please drive safely on your return trip home and get some rest. For those of you with shorter Greenville-based journeys ahead of you, please be safe as well, and I hope to bump into you sometime in the future around town.